Here is the new VisioFocus Professional model. VisioFocus has 3 buttons. Face button to take the body temperature on forehead or on the eyelid. Home button to take the temperature of liquids and objects between 1 to 55 degrees Celsius, that is 33.8 to 131 Fahrenheit. Memory button to recall the last 9 measurements. How to use. While pushing the face button, move the thermometer closer to and further from the middle of forehead. When you see the temperature between the 2 brackets, the distance is correct, and so is the temperature. When out of the brackets, it is too far or too close. When you are at the correct distance, release the button and read the temperature also on the LCD display, backlighting light blue for body temperature. Use the home button to take skin temperature, such as inflammations, blood circulation problems, diabetes, wounds, burns, scars, or to take the temperature of objects or liquids. The display will be backlighted in green. Pay attention not to use the home button to take the core body temperature. For that purpose, you have to use the face button only in the middle of forehead. The device can be set in different modes. The most important ones are the settings doctor and nurse. In airports, and when many measurements have to be taken in a short time, we suggest you set it in nurse. While set in nurse, the home button is disabled. If you push it, you will see off on the display. And very important, the manual quick calibration system, MQCS, is mandatory. This means that if you don't calibrate, the device won't let you take any measurement, but it will suggest to make the calibration. Proceed as follows. Push face and home button together. On the LCD display, the word call will appear. Aim the device towards an internal wall and push the home button until you are at the correct distance. Release the button, the lights will flash slowly, which means that the device records this temperature as reference and will use it for the following 30 minutes. After 30 minutes, the device will consider as mandatory a new calibration. It is possible to choose between 2 optical alarm levels, 98.6 and 100.4. When the temperature is over the pre-selected level, the projection will alternate for 7 seconds between Hi2 and the temperature. How to change settings. With the thermometer off or in standby mode, when it shows the room temperature and the home icon is blinking, press and keep down the memory button. After 8 seconds, the display will start to show all options one after the other. When you see the desired one, release the button. Celsius, Fahrenheit, oral reference, rectal reference, axilla reference, core reference, nurse, doctor, 98.6 alarm level or 100.4, air-conditioned option, you can choose yes or not, again Celsius, Fahrenheit, and so on. If you need to take the temperature to people outdoor, you can make the manual quick calibration on an external building, on the floor, or on a trunk. Be sure that they have a temperature similar to the environment temperature, not directly exposed to sunlight or to heating or cooling sources. Then, you can go directly on the forehead.